Excellent. All right, big day, a little bit of a chilly room. How are we hanging in? We're here, we're good. So another temperature check question, not literally this time. We've talked a lot about AI and really cool technology things today. Great. How do we feel about implementing those? Do we feel like they're a little bit hard or a little bit expensive or both? Yeah, everybody's nodding. Yes, so they're worthwhile. They're not quick fixes, and they're not a solution in and of themselves. They deliver a solution. They deliver your way of thinking, but in and of themselves, it's not the answer, right? It needs to be conveying the content. And so that's why I'm bringing us back to health literacy now. We're not going to talk about AI. We're not talking about tech tools here. We're talking about a way of communicating that is effective for all audiences, not just patients, and we'll talk more about that. Think of this as more of like a training than a talk. We've been up here all day. We're coming back down to earth right now. You're going to walk out of here and be able to use what I teach you in your very next email, all right? And beyond, obviously. But this is going to be very concrete, and there will be a quiz at the end, so pay attention. I'll tell you which slides are the most important, so don't worry. But I've delivered this kind of content to train folks at the New York City Health Department, to train people at Columbia's School of Public Health. A couple lifetimes ago, before I was in consulting, before I was in marketing, I was an academic, did a lot of academic research on health literacy. This is a field that's been around for a long time. These papers up here from about 10 years ago. So this is something that's been studied, is continuing to be studied. And I know some of you are probably already aware, or you talk about this in your organizations, but I can tell you from when those papers were published to now, and likely ongoing, every day I see healthcare content for all kinds of audiences that is not checking the boxes of the most important things that we need to do to communicate health information effectively. So there's always an opportunity to improve this, and it's really critical that you get this right, because frankly, there's no excuse. It's practical. It doesn't cost you extra money. You just need to make sure you're using the right tools. So you're going to walk out of here being able to do this, to communicate more effectively, to activate your target audience without spending another dime. So hopefully that will help us hang in there. Whoops. All right. Excellent. That looks fabulous. All right. We're going to hang in there. So why is health literacy important for digital health communications? Obviously, health literacy is important across all channels, but it's especially so in the digital space because it is so crowded, because it is so noisy, because people are so distracted when they're engaging with these channels. We're going to ground ourselves in a definition because everybody thinks of health literacy in different ways, so we're going to get on the same page today. Interestingly, the official definition, so to speak, from Healthy People 2030, this was just updated a couple of years ago. It has two parts now. The first part is on the screen, which talks about personal health literacy. And this is all about an individual's abilities. Can you find information? Can you process the information? Can you make decisions and take action based on health information? Fairly straightforward and intuitive. What's new about this definition is the second part that they added, which is organizational health literacy. And this says, essentially, it is not all on the patient to make this happen. It's not just about the patient developing their skills. The responsibility is also on the organization to make sure that the information that we put out into the world is enabling patients to find it, to understand it, to act on it. And so we're all patients. We can all work on our health literacy skills, but we are also in this room because at some point we touch or are involved with creating health communications. So this is all of our responsibilities, and therefore it's important no matter where you are in the process to be aware of this so we can be supporting it at every step. So let me give you a couple stories just to illustrate what can happen when we don't do this right. True stories. So the first one is about a gentleman who had diabetes, and he had to start taking insulin injections. And so they did the training, and I'm not sure if they still do this now, but back in the day, they did teach you how to inject insulin by using an orange. Got kind of a safe guinea pig there, right? Not sacrificing your body for that one. So he successfully passed his injection training. He went home, and not long after that, he ended up in the hospital. And he was sugar was super high. And they were like, dude, what happened? haven't you been taking your insulin? And he was like, yeah, I've been injecting and eating the orange every single day, just like you showed me. Right? So if you think you've made it simple, you can probably still make it simpler, because there are lots of ways this can go wrong. So we want to make sure we avoid things like this. Another example from a slightly more well-known character. A number of years ago, Rudy Giuliani went in for his annual prostate checkup, and the doctor called him back and said, Rudy, your cancer screening results were positive. And Rudy was like, awesome, positive, that's great news, thank you. Talk to you later, doctor, see you next year. And the doc was like, no. Positive means you have cancer, right? And obviously, Rudy Giuliani is not the most grounded of characters these days, but he is highly educated, and he does have access to a lot of resources. So he would be someone that you would expect not to have such a basic problem with health information, and yet here we are. Again, true stories. So this can go wrong in a lot of ways, so we need to make sure, again, that our foundation is perfect before we start adding on all kinds of fancy stuff to it. And I alluded to this before, but I'm going to reiterate it now, because I know my HCP folks, it's easier for you to check out when you see health literacy, because everyone thinks it's just for patients. But HCPs need this too, for a couple of reasons. First of all, very obviously, we talk about this all the time, HCPs are very busy, they're very stressed, they don't have a lot of time and attention to pay to any one thing. And so, of course, they're going to prefer something that's easy to process, right? Sure, they have the training to decode the high science, but do they want to do that? Probably not. It's probably nice for them to have something that's easy to understand. So you're doing them a favor, and you're providing them with a good customer experience, essentially. Second of all, and perhaps even more importantly, is if you're talking to the patient in patient language, and you're talking to the HCP in HCP language, you're then putting all of the onus on your healthcare provider to translate when they get into the same room to have a conversation. That is the last thing you want to do. That is not their specialty. That is not what they have time for. Most of them aren't interested in that, and that's a whole other higher order skill that they're not really trained in. So what you're doing is you're shooting yourself in the foot, because at the end of the day, what we're trying to do is get patients and HCPs to have an effective conversation. That's the ultimate goal. And so you're going to enable that much more effectively if you're equipping them both with the same kind of language in the first place. So when they get in the room, they're already speaking on the same level with the same concepts and the same framing, and it's going to just go much more smoothly for everyone, which is a win all around, obviously. So for you, why is this important? Quick question. If your doctor told you, take 2 pills twice daily, would you know right away, for sure, with zero doubt, what they were telling you to do? Everyone's like, I want to say yes, but now I'm second guessing everything. Okay, so 9 in 10 adults in the US would not interpret that statement correctly, because 9 in 10 adults in the US have below proficient health literacy, and to have proficient health literacy, you need to be able to be for sure understanding what that sentence means. And that 9 in 10 adults, that's all ages, all demographics, all income, all education, that's everybody, right? These are hard skills. We say we know that, but it's harder than we even give it credit for. So you really have to be deliberate about how you communicate, right? Because that statement, right, that could be, do I take 2 pills once and then 2 pills again? Or do I take 1 pill once, 1 pill again for 2 total, right? Just a simple misinterpretation could be frankly deadly, right? But we see that on every prescription model. So we haven't even fixed that yet. So obviously that's problematic in a lot of different ways, which we'll get into, but on a big picture business level, low health literacy is costing the US economy $236 billion every year, right? That's for pharma companies included, but also the economy overall. Why? Because what's happening? People with low health literacy skills are more likely to have poor outcomes in general, right? So we're gonna have more hospital stays. We're gonna have more emergency room visits, like our friend with the orange. We're gonna make medication errors, like that example would take 2 pills twice daily, and that can lead to lots of different issues. We're gonna have trouble managing our chronic diseases, which includes medication adherence, which I know all of you know is already the billion-dollar, multi-billion-dollar opportunity in pharma anyway. We're going to skip preventative services. So by the time we do take care of that medical issue, it's much more involved, much worse outcome probabilities. And then there's the flow-on effect, multi-generational. If a caregiver has low health literacy, the child that they're taking care of also can have lower health outcomes as a result. So this is not only a huge business opportunity, it's also obviously a moral imperative to make sure that we're doing everything we can on the organizational side to communicate in a health literate way for everyone involved in the healthcare ecosystem to benefit. So, how are we going to do this? These coming slides are where the quiz test content will be coming from. So just a little hint for you. We've got 4 categories of recommendations. First one is content, which is all about what you're communicating. First things first, rule is put the most important information first, which is first. 2 reasons. 1, our brain simply remembers things better if they're the first or the last in a list or in a paragraph or whatever content you're communicating. Anything in the middle starts to get a little bit fuzzy. So put it first. Putting it first also helps to imply that it's important. This is just kind of a shortcut that we have in our brains anyway. So this is a very easy thing to do. Use plain language. So everybody who has heard of health literacy thinks that health literacy is reading grade level, period, the end. That is one small piece of health literacy, which we are going to talk about here, but there's a lot more to it. So when we're talking about health literacy and we're talking about plain language, yes, reading grade level is very important. Best practice is 5th grade reading level. Has anyone tried to write at 5th grade reading level before in the healthcare space? It's difficult. It's hard. Nobody is doing this on accident, I guarantee you. The things that people do naturally when they're writing healthcare information is usually at least 13th grade and above, right? Nobody's even close on accident. So when we're aiming for 5th grade reading level, you must be doing this on purpose. A couple of tips, really simple. Avoid using words that have more than 2 syllables. Use shorter sentences. Like if you needed multiple commas in your sentence, it's too long. Cut it up. Very simple things like that. Other recommendations that help with that, using active voice, not passive voice. So an example, passive voice. The talk was given by Suzanne. Active voice, Suzanne gave the talk. It's a lot clearer. You also usually use fewer words, which is a benefit. But what we're doing is we're removing ambiguity. We're being very direct in the way that we speak so that there's as few opportunities for confusion as possible. Also, when we're telling people what we want them to do, tell them, address them. It's very, very common to see something like, it is best if patients do XYZ, or it is recommended that XYZ. Don't do that. Say, you should, right? Just like I'm speaking to you now, I'm bossing you around. Thanks for bearing with me. But that's really important, right? So people know, like, oh, this is for me to do. This is not just like a, oh, that would be nice if, right? Make it clear. Images and icons. Very important to include. The word relevant is also very important here for a couple of reasons. 1, your images and icons can be a wonderful, wonderful tool to help people understand your content better. So you should use them, and you should use them with that intent. You should not be using them as decoration. It should not be a pretty picture. I know the trope is the happy people running through the field. We all love to make fun of it, but it keeps happening, so we're going to keep talking about it till it's fixed. But you want your images to help reinforce or add to the meaning of your copy. The word relevant also means not contradictory. You would be shocked at the number of images I've seen. Like when I was doing the academic research, we were creating new tools for how to evaluate images in health materials. And so I looked at a lot of health materials, evaluating the images, and so many of them would have something that would directly contradict the text in the picture. For example, there was a website about teaching patients with chronic kidney disease how to modify their diet to manage the condition. And there's lots of specific diet things in CKD. One of them is reduce your salt intake. Fine. There was a picture of a lady eating a salad. We love that. Very healthy. Nice. Next to her on the table was a pepper shaker and a salt shaker in the picture. right? So they use some stock photo of a lady eating a healthy food, didn't pay close enough attention, and now you're showing a behavior that you absolutely do not want in this patient population. So be really mindful, use your images, use your icons, they help people understand, but don't be contradicting the text. We want to limit the number of concepts presented at once. There's a psychological rule called Miller's Law, which says we can hold between 5 and 9 things in our working memory at any one point, so be actively grappling with that number of concepts. Obviously, less is more, so don't be loading people up with too much stuff, which is why we're going to stop with number 5 here. We want to make sure we end and begin, if it's appropriate, with a very clear and realistic call to action. So as a behavioral scientist, it's very important to me when I'm looking at a communication to understand, what do you want someone to do as a result of reading this? Not what do you want them to think, not what do you want them to feel, not what attitudes do you want them to have. What do you want them to do? And that could be talk to their doctor, obviously. That could be, have a conversation with your partner. That could be go Google this thing. That could be sign up on our website. But there needs to be a behavioral result of that communication. Otherwise, what was the point, right? So when we're thinking about the behavior, A, there should be one. You should have a behavioral goal for every communication. And B, of course, you should make sure it's very realistic and clear. You don't want to be asking someone to change everything about their life as one simple call to action for a website. You want to make it very concrete, break it down step by step. So that's the content. Again, that'll be in the quiz. Lock it away. Now we want to talk about design. We're in a digital marketing conference. In the digital space, when someone's looking at a screen, they are not reading, they are skimming. So you need to make sure you're designing your content accordingly. Some things to help you with that. Very technical term called chunking. Essentially, put your information in chunks, right? Visually separate it so it's very easy and inviting. What you don't want to see, and we know this, but again, it happens, is a big wall of text. That turns people off. They're not going to engage with your thing, or they're only going to read the first sentence and then they're going to run away. So we want to break things up really nicely and visually. Bullet points lists can do this. Informative headers are really helpful. So imagine if someone only read the headers, would they get what they need to get? That's a really good litmus test. Usually we have very generic headers and it's not very helpful. So just whenever you're writing something with headers, think about, am I conveying the main point with this if they didn't read anything else? If something's really, really important, put it in bold, put it in a nice colored box. And of course, we want plenty of white space. Again, we want to be visually inviting. We don't want to freak people out. We don't want to overwhelm them. We know that they're going to be skimming and not reading, and so we want to make it as hard as possible for them to miss the point, given that that's the behavior that's going to happen. This is basic, I know. It still doesn't happen very frequently. We see content like this all the time that doesn't check these boxes. This is why we're coming back to this and regrounding ourselves so that you guys are not missing really easy opportunities to make an impact for your patients and for your healthcare providers. Last couple buckets of recommendations for our health literate communication is channel, of course digital, but within digital there's lots of different sub-channels. Want to make sure you're choosing the right ones, including the informal ones. We've had lots of great recommendations about social media, different sites, who's engaging with what. Keep those in mind. We've already learned a lot about those today, but don't forget the informal channels is the real kicker there. And then the messenger. So the exact same content delivered by person A can be received completely differently if that content is instead delivered by person B, right? So you want to be really deliberate with that, whether that's the email that you send your patient support emails from. Is that sent from a named person? Is that sent from the pharma company? Is that sent from the program? What are we, how are things coming across on social media, on our website? Who is this stuff from? It matters, so be really thoughtful about who you're choosing for any given audience. And of course, repetition is critical. So not only for memory, but also for believability. The more we hear something, the more we think it's true, and the more we trust that information, no matter what it was. So it's important that if there's a really key point for you to get across, repeat it a few times in your content. And then finally, inclusion is really critical for making health literate communications as effective as possible. So there's a principle in public health called nothing about me without me. If you're making something for X target audience, include them in the creation process as much as you can. Lots of different ideas for how to do this. I'm sure you've all done at least some of these at some point. The more, the better. So whether that's having interviews or focus groups early on to understand, whether that's having advisory boards for more ongoing kind of feedback, whether that's for co-creation sessions where they're really helping to actually develop that content with you and not just reviewing it after you've made it on your own. Making sure that they do review it before you launch it, and making sure you always test and pilot things before you launch them, because you can do all of the research in the world, but without having the actual people in the room with you, you're just not going to be hitting the mark as effectively. And so this is best practice when it comes to health literate communication. I promised you a test. We're here. So we all write 1 million emails a day. We all read 1 million emails a day. You've probably created emails for your HCPs, for your patients at some point, for your brand at somewhere. So what we're going to do is we're going to optimize this one together, putting into practice the principles we just learned. Can we read this, or shall I read it to us? We can read it? Excellent. All right, so what's our first impressions? What do we see? First thing you thought when that came up? Too much text. Ugh. That was my first impression. Oh, God, I have to read this? Exactly. So we're not chunking. We're not leaving enough white space. What else are we seeing? How could we improve this content to make it more actionable? Excellent. Yeah, so it's usually recommended that people don't wear red or white, or don't wear white or stripes. Say, you should not wear white stripes or stripes. Excellent. What else? Sorry? Passive voice. It is recommended that. Exactly. Excellent. What would you argue is most important? Yep, because that will look really terrible. Great. Excellent. Most important thing first. What else? Right. We want them to show up, right place, right time, regardless of what they're wearing. We would like them there. Excellent. So we should move that up, not at the end. What else? Subject line. Just says tomorrow. What is that? That's ominous. I'm sorry? Yeah, there you go. So start thinking through, okay, what action am I asking them to do? I'm asking them to show up to this new place at this specific time. We're doing something kind of maybe a little nerve-wracking. Let's make sure this is a really realistic thing for them to fulfill by giving them the tools they might need. Let's give them the contact number just in case. Excellent. What else?
A little bit more clarity around the color portion. Good color.
Yeah, what is a good color? I thought white was a good color. Now I'm lost. Yeah, exactly. Good. Bullet points. We love a bullet point. Excellent. All right. All right, congratulations, you all passed. So this is an example of how you could rewrite this email using the principles that we've all reviewed today. So you can see subject line, as Lucine pointed out. It's now specific. Review. We've got the call to action. Very first word they're going to see of this email before they even open it, there's an action. Review this. Video shoot instructions for this date. So you know exactly what this is. There's no mystery to it. And you know, hey, I actually need to look at that before that date. Then we've got informative headers. Location, clothing tips. Don't forget, they're in bold, so they stand out really easily. You can skim this. We've got the location right away. 3rd floor, room 8. I don't have to look through that long paragraph to be like, where are those numbers? I don't remember what floor. Clothing tips. We've got the bullet points as was suggested. Don't do this, don't do this, do this, do this. We are addressing our audience. We're being very clear and explicit. They said good color. I agree. We should be a little more specific about good color, but we're getting an A. You guys can make the A+ next time. And then don't forget, be on time. Lunch is provided. So this is an example of using images and icons to add clarity, right? I see a pizza. I'm like, sweet, food's covered. I don't even need to read that sentence. I know what pizza means. So emojis, obviously, be thoughtful. It doesn't have to be an emoji when we talk about images and icons, but it can be. But this, how do you feel when you look at that versus when you look at the original? And the best part is it took up less space. Like, this is so much simpler, so much easier, so much more inviting, and it's also going to get you the outcome that you want. Because again, we have a behavioral goal for this communication. We want this person to show up, right place, right time, right outfit. You're making it as easy as possible for them to do what you want them to do. So this is in your benefit as well. Excellent. So with that, I will just remind you that this is for everyone. This is for patients and HCPs. These techniques don't cost you anything extra. You just need to remember to use them every time for every communication. You can even use them in your own emails. And this doesn't have to be high technology, really difficult stuff, but it's very important with a really great payoff. So thank you very much.
Thank you, Susan. Wonderful. Nice concept to almost end on, I should say.